All right. Good afternoon, everyone. Come on in. We're just going to be wrapping up the last session here. Our topic this afternoon is how organizations are leveraging their data. And so you're going to hear from our distinguished panel members about some of their experiences, things that they're doing in their operation. We'll have an opportunity for questions. But first, I kind of would like to get started with a few remarks. So in 2016, half of the world's population became connected to the internet. And today, there's probably we surpassed, 7 billion devices. My understanding and doing some research, there's going to be, in the next 5 years, probably 50 billion different devices that are going to be connected. So there's a lot of data that is coming from everywhere. We're seeing connections, new connections everywhere, smartphones, laptops, sensors, vehicles, appliances. All of those connections are generating massive amounts of data for businesses that can transform and manage it. Data represents a huge opportunity as a competitive advantage. Big data is touching every industry and every individual in some way, from information technology to business leaders to consumers we serve. If you heard about the lunchtime presentation, you heard from Waze. Keynote speaker said, how do we remove the pain points from our lives? And that's how some of these applications are being developed. We have ways in terms of how do we navigate through traffic. You also have Uber now, which is the largest taxi company in the world that doesn't have any vehicles. So the way we communicate with machines is fundamentally changing. Customer behaviors is constantly evolving, and people are in favor of those brands that are keeping up. Effective error and failure prediction will increasingly inform and automate business processes. From Fortune 100 companies to nimble startups, businesses have learned to leverage their data and translate it into business success. It is no secret that big data can be a wealth of valuable insights and produce tangible results. But you need to compile it, analyze it, and communicate your data effectively. You need to capture data in a structured form, normalizing it for analysis, exchange it at the right place at the right time, and while keeping it private and secure. Folks want to be able to integrate it, ask questions of the data, then collaborate and move information around in the space. Join it together to get some value out of it. Big data and cloud are two technologies that are driving some of these dramatic transformations, and we need to be ready to take advantage of it. So today you're going to hear from panel members from the Department of Healthcare Services Resources Agency, as well as Department of Transportation, as well as Accenture on what they're doing. So with that, I'm going to ask each of the panel members to introduce themselves and for 10 minutes or so to talk about how their organizations is leveraging data. And once we get through all the different panel members, there will be an opportunities for questions from the audience. So with that, I'm going to turn it over to Dr. Linette Scott.
Great. I'm going to wait for the announcement next door to finish.
That would be good.
Right? I think that's what they're saying, right? Excellent. Well, thank you so much. It's a real pleasure to be here. As Karen said, my name is Linette Scott. I'm with the Chief Medical Information Officer at the Department of Healthcare Services, which is in our California Health and Human Service Agency. And it's still a somewhat new role, although I've actually had this position for 5 years now. So I guess I can't quite say that anymore, but it was new when I came to it. And so it's been a fantastic experience to work with folks throughout the department and the agency in what this role of a CMIO means, a Chief Medical Information Officer. So I'm a board certified physician in general preventive medicine and public health, as well as board certified in clinical informatics. So I'm a clinician that speaks data and technology is usually how I translate that. And that's a lot of my role, is translating between what we're trying to do from a business perspective to what it means for the technology environment. And so and the other way I describe my role is to say I work with the data stuff. Our CIO, our Chief Information Officer, Barney Gomez, is our lead for our technology services, and as many of our vendor partners and such come to talk to us, they'll often say, I have a great product, and I say, great, go talk to Barney. But when we want to know what sits in that system and how do we use it and how do we turn that data into information, that's kind of where I focus as a CMIO. And so we partner very, very closely, Barney and I do. And we're very pleased to have chances to work with all of you as we think about how we turn data into information. When we were touching base in terms of topics to cover, one of the areas that I thought I would touch on is a lot of the work we've been doing around governance and what that means around some culture change in terms of how we think about data in the department and the agency. And as I turn it over to my colleagues here, they'll be talking about data from some other perspectives. So within the Health and Human Service Agency and within the Department of Healthcare Services, we've been doing a lot of work around what it means to have governance, and in general, and specifically around information and technology activities. And so out of some of this actually grew out of the HITECH Act. Some of you may remember that. It was the Health Information Technology for Economic and Clinical Health Act of 2009, and that got the revolution around electronic health records started. And we continue to support that. We continue to have a program to incentivize the use of electronic health records. But as we started that, we were looking at how do you start to connect healthcare? How do we start to go from a paper-based system to an electronic system? And we realized within the state that as we looked at what we needed to do, including the standards, the interoperability, the connections, a lot of it all started with governance, because it was about how do we work together and how do we trust each other and what the other entity is doing. Because if it's a hospital that's collecting data and then it's going to another hospital or it's coming to us at the state, and we need to share that to take care of the same person, how do we trust each other around that? And so we've done a lot of work around governance, and we've had a governance structure at the agency now for a couple of years, focused on our data, risk management, technology services, portfolio management, procurement, and adding most recently communication and innovation. And at our Department of Healthcare Services, our Medicaid information technology architecture work has been driving our governance, again, around the business, around the information, around the technology. And with that, we've been able to accomplish a number of things. One piece of that has been our work around open data. So earlier at the lunchtime plenary, they talked about how we're really good at putting out PDFs in government, right? Well, the cool thing about the Open Data Portal is that our Health and Human Service Agency, we have over 200 data sets. They're all API enabled. There's no PDFs whatsoever. It's all reusable. And it's also exciting that earlier one of the folks here came up and said, gee, look, here's the computer, here's the app I already put together. It's using all of the data on your Open Data Portal, and these are the community services in a local community. I can zoom in and use it. And that's exactly what we're trying to do, is drive innovation, use of the data in a public arena to get services to the people that we're taking care of and making that more coordinated. That wasn't possible without the governance structure. So with the governance, we've been able to make that move to the open data, improving our transparency, and then following that with other tools that help. So data de-identification has been a really important part of that. Most of our data is confidential in some way. Many of us in the agency are HIPAA-covered entities, so it's very important to keep that appropriately secure and de-identified. And having a shared set of guidelines for the whole agency has been very helpful with that. We've also, as an agency, signed a data sharing agreement. All of the directors in the agency have signed a data sharing agreement among the departments so that we can start to share data as we need to, again, because many of us are taking care of the same people. And so it's really focusing on how we use information to better provide better services, better outcomes for the people that we're taking care of. And we've been working hard on getting the word out. We still go and check in with folks and say, okay, so I'm going to do the survey. How many people here have been to the chhs.data.ca.gov? You can raise your hands loud and proud. Okay, so those of you that haven't, I encourage you to do so. And we also have our Open Data Handbook and a data playbook that we've posted, and the Open Data Handbook, data playbook are on GitHub. So again, trying to really encourage transparency. We're happy to have folks reuse, borrow, use, what have you, in terms of how we advance the use of data and information for public consumption and advancing the health of the communities. So I think I'll probably stop there. I want to pay attention and make sure we have time for questions, but really appreciate the chance to be here and really excited about the work we're doing in terms of making data available and used by not just us and our sister departments, but also by the public and consumers at large. So thank you very much, Karen.
Great. Thank you, Linette.